I'm Dr. Janet Pope. As a rheumatologist, I'm here to give you a quick overview of the risk of pulmonary fibrosis if you have connective tissue disease like rheumatoid arthritis and scleroderma, and treatment options, plus the steps you can take. CTDs are autoimmune diseases that fall under the umbrella term of interstitial lung disease, or ILDs. It's important that you know your condition can sometimes progress to pulmonary fibrosis, or PF. This is a disease which the lungs become scarred. You can see the chances of getting progressive pulmonary fibrosis vary according to your connective tissue disease. Catching early changes is vital because once the lungs become scarred by PF, it's irreversible. If there is lung inflammation, some immune suppression treatment may improve the lungs. Usually, we are trying to slow progression. What is pulmonary fibrosis? Imagine a sponge. If some areas of the sponge are hard, then it's difficult to absorb liquid. Healthy lungs allow gas through to release carbon dioxide, but when they are scarred by pulmonary fibrosis, it becomes hard to breathe and do your daily activities. For detailed information about pulmonary fibrosis, take a look at the excellent video narrated by Dr. Charlene Fell titled, "I've been diagnosed with PF, what's next?" Each connective tissue disease with pulmonary fibrosis has different characteristics. Early diagnosis is vital to determine the right treatment pathway and slow down PF progression. What are the early signs of pulmonary fibrosis? Common early PF symptoms are shortness of breath, a cough that won't go away after 3 months, and/or ongoing fatigue, possibly accompanied by weight loss. A telltale sign for doctors is distinctive crackle sounds we can hear with the stethoscope, usually around the bottom of the lungs. I listen to the lungs in every patient with connective tissue disease who comes in to see me. It only takes 4 seconds and it can help catch early PF. It's important to tackle the crackle early on so treatment can start as soon as possible. If lung crackles are heard, a referral should be made to a specialist who will order tests which can include PFTs, or pulmonary function test, CT scan or CAT scan of the lungs, also called HRCT, possibly a tube looking down the lungs, bronchoscopy, but we don't usually need to do that if a patient has a connective tissue disease. There's also a test called the 6-minute walk test. Does an ILD always need treatment? The answer is maybe. About 40% of ILD patients will progress or get worse and need to be treated. We don't want to over-treat and risk infection or drug side effects if there's no progression, but we don't want to under-treat if you're in a group that might progress their pulmonary fibrosis or their ILD. Rheumatoid arthritis, or RA, is an autoimmune disease that attacks healthy cells in your body by mistake, causing inflammation in the affected parts of the body, usually joints. It affects about 1% of the population worldwide, 80% are women, and 7% of RA patients will develop progressive pulmonary fibrosis. This is a CT scan of the lungs of an RA patient with PF. These little holes shouldn't be there, and that's where there has been scarring. There's thickening as well seen on this CAT scan. Good news, treating RA can protect against PF. Many of these drugs are what we call lung-friendly. To treat PF progression, these are the ones you may be prescribed. Also referred to as systemic sclerosis, scleroderma, which means tight skin, is an autoimmune disease affecting almost every organ. Not your brain, but from your skin, joints, arteries, kidneys, and also your lungs. So it looks quite different for different people. Scleroderma affects about 14 per million, so it's a rare disease. It's most common in women, especially aged 35 to 54. 30%, or 1 in 3 of patients, typically could develop progressive pulmonary fibrosis. This scan shows a scleroderma patient with pulmonary fibrosis. That's the fluffy stuff you see at the bottom. After studying thousands of cases, we have found that about 1 in 3 people with scleroderma have ILD, and about half of those will go on to pulmonary fibrosis. Having PF with scleroderma is a serious complication, so getting treatment as soon as possible is very important. This CT scan shows some of what we refer to as honeycombing at the bottom of the lungs. This is PF. If you have scleroderma, you should be screened for ILD and pulmonary fibrosis because it's quite common, it's a complication with a high mortality, and because it is somewhat treatable. Our goal is to reverse if the patient has non-scarring that's reversible, meaning NSIP or non-specific interstitial pneumonia, stabilize or slow worsening if pulmonary fibrosis or usual interstitial pneumonia is present, depending on the case. Pulmonary fibrosis and other connective tissue diseases. If you have one of these other CTDs, talk to your doctor about the risk of pulmonary fibrosis. The treatment outlook is hopeful. While the first priority is to treat your underlying connective tissue disease, it's important to also think about treating the lungs. I think there is great hope for people with PF. There's a lot of promising research being done right now. My patients with CTDs are doing better than even back in 2018. We've come a long way. There's a lot you can do. Tell your doctor about any of these early signs of PF. Ask your doctor to listen for the telltale crackle sound in your lungs, refer you for PF screening tests if needed, and make sure taking care of your lungs is an important part of your treatment plan. It's also important to exercise regularly, stop smoking, get vaccinated, get lung infections treated promptly, attend your follow-up visits, including regular testing, if on oxygen to use as prescribed, and to reduce the chance of lung aspiration by treating acid reflux or GERD. The Canadian Pulmonary Fibrosis Foundation is an excellent organization dedicated to providing hope and support for people affected with pulmonary fibrosis. They offer access to the latest pulmonary fibrosis research, medical professionals, presentations, resources, local support groups, and a caring community of patients and caregivers. Learn more about pulmonary fibrosis at cpff.ca. Get the facts, stay connected, get involved at cpff.ca.